Good afternoon, everyone. Today is our meeting, like monthly meeting, like every month we are doing during 4 years consecutive. That's an amazing space that we can invest in ourselves just to educate and also to know new professional and also to do amazing networking together. Today, our topic is intimate treatment, care, and wellness. For all who you don't know me, my name is Idalis Bailey with more than 10 years experience, registered nurse, and also with MBA in marketing. Also a skincare expert in the global integral beauty, New York State licensed medical esthetician, author, bestseller from the 2 edition global expert in integral beauty, certified in all the laser treatment, aesthetic laser treatment, and also working so many years working with all the communities together. ¿Cómo puede usted trabajar con los profesionales multidisciplinariamente, tanto la parte estética, psicología, nutrición, toda la área de multidisciplinaria para poder ayudar a un paciente que se encuentra en unas condiciones como esta?
Tenemos claro que es una paciente joven con una menopausia precoz. Desde ahí tenemos un signo de alarma. Podemos ayudar a esta paciente mediante el equipo multidisciplinario a hacer un diagnóstico asertivo de qué otras consecuencias puede atraer este tipo de problema. Y obviamente esta paciente debe sí hacerse un seguimiento mediante psicólogo, ginecólogo, médico, medicina funcional y obviamente médico estético por los trastornos que va a presentar y las consecuencias a nivel psicológico. Eso es muy importante. ¿Cómo abordaríamos a esta paciente? Lo primero es hacer una evaluación completa, un diagnóstico completo de qué se está presentando en la actualidad con la paciente, ¿no? Entonces, más que irnos al lado estético, recuperar su forma o su autoestima, tenemos que hacer un chequeo psicológico para ver cómo esta paciente puede evolucionar cuando nosotros hagamos su tratamiento médico estético, ¿no? Y tenemos que ir de la mano con el tratamiento ginecológico, porque si estamos hablando de menopausia, sabemos que cuando hay menopausia hay varios factores que hacen que se presenten ciertos síntomas como sequedad vaginal, dolores al tener relación y este envejecimiento o flacidez vaginal debido a consecuencias de este problema. Por tanto, esta paciente tiene que recibir un tratamiento o una terapia hormonal al momento que también el médico esté pensando realizar un tratamiento estético, ¿no?
How can multidisciplinary approach involving gynecology, aesthetics, medicine, aesthetics, and also psychology support how it can help to contribute for a patient to get better in this case?
So I think generally speaking, when it comes to aesthetic consultations, it's always best because people come in with a perceived or real issue with either their skin or, as we're speaking about now, their genital area, and it takes a lot of bravery to actually reach out for help. And because of that, it should be that when they finally do so, they're able to get the best possible help. And it's in medicine, we have different specialties, and not one person knows everything. So it's always good where there is a team that can address the different concerns from different perspectives. So for example, with this patient, there are issues with the gynecological history that if a gynecologist is seen, will be able to pick up and investigate properly before bringing up solutions that would be helpful. And then from from my perspective as an aesthetic physician, I'm saying things about the fact that she has skin sensitivity. So that would guide my approach also to how to proceed with treatments.
I think that to echo what has already been stated, a holistic approach is very important, involving the expertise of all the specialists in the different areas, gynecology, aesthetic medicine, aesthetics, psychological support, to receive the most well-rounded treatment that addresses both of her physical symptoms and her emotional well-being. And when we combine these treatment specialties and monitor her treatment, this multidisciplinary team can provide an upward spiral effect, meaning that with improved physical symptoms, that can enhance her emotional well-being and vice versa. Additionally, from like a mental health perspective, having a team, a strong support network of professionals that are helping her, I think will really help improve the treatment plan and help improve her quality of life.
¿Cuáles son los tratamientos más efectivos no invasivos de rejuvenecimiento vaginal?
Generalmente en la actualidad existe muchos tratamientos y el de preferencia son los tratamientos combinados. Siempre lo hemos dicho. Se usa el láser, diferentes tipos de láseres como el híbrido, el fraccionado, que es el de elección, y este logra mejorar gran porcentaje, casi un 60-80%, el rejuvenecimiento de estos pacientes mediante la aplicación de este tipo de láser. También usamos, no invasiva, sino más superficial, la hidratación mediante ácido hialurónico. Yo creo que estos tratamientos vinieron para quedarse, son una herramienta muy adecuada para, a nivel estético, mejorar la textura vaginal mediante la elasticidad y obviamente el aspecto externo también vaginal, que es vulvo vaginal, que es muy importante para todas nosotros, ¿no? Entonces son dos tratamientos que yo recomendaría.
How can aesthetic medicine complement vaginal rejuvenation treatment, and what option could exchange Laura's sexual self-esteem considering her emotional and physical state?
From a medical aesthetics point of view, we'll be looking at vaginal rejuvenation treatments that would improve hydration and also improve sensitivity. So firstly, because of the history of what looks like an early menopause, there are other options that would be using of creams that contain estrogen, but there are some contraindications in that regard. So something that can be helpful as an alternative is hyaluronic acid filler injections placed within the mucosa. So that would increase the general hydration and sensitivity within the area. Then another option, especially seeing as she has more sensitive skin, would be to look at a treatment that would be using her own body cells. Basically, I'm talking about PRP treatment, so from the O shot. But the PRP can also be injected within mucosa region apart from just the clitoral hood. So that brings up rejuvenation as well. Now, when it comes to using devices, there's the option of doing laser treatments and also LED therapy for anti-inflammatory and also some subtle tightening. But this would have to be done in combination with other, for example, for me, I would want that interdisciplinary management because from her gynecological history, she would still need further assessment and treatment to possibly slow down the rate of the other effects that would come up as a result of the early menopause. And then from a psychological perspective, so a simple hyaluronic acid.
How would you approach her psychological care, to improve her emotional well-being and confidence? What kind of therapy or intervention you recommend to her to make her feel better, more confident, and also because they are working with the doctor, also is very important the therapy and how you can combine all this. What is your suggestion in your area, Mickey?
So very often the first thing that I do is a brief assessment to understand Laura's psychological discomfort, address the underlying issues. And when I learn that there are other specialists, other doctors involved, which of course they would be in this intimate treatment, I would request that I can communicate with them just to better support her. And having that open line of communication, I would pull from different therapy modalities such as mindfulness, cognitive behavioral therapy, acceptance and commitment therapy. But basically, I would focus on acceptance, self-regulation, seeking support, and how to live a very more balanced lifestyle so that she's also not only focused on taking care of other things in her life, but focus on taking care of herself.
How often they say we have to get the therapy to maintain a balance in my medical treatment too?
My first answer is it depends. But what is typical, the level of psychological discomfort, what's going on, how impactful is this on your life right now? Usually with therapy, I would start once a week or twice a week if I'm working with a client that's really struggling. I think that the length of time or how long I meet with a client is really dependent on the rate of their progress. And a lot of things go into that. Homework outside of session, usually yes. And so I would say that therapy can be very short term. It could be a few months. It could be a year or two. It really depends on how long a client needs that kind of support. And there will come a time where I've worked with many clients who are like, you know what, I think that I'm doing really well right now. I'd like to maybe just meet again on a check-in basis. And I do that as well, just like once a month, once every other month. So yes, it does depend.
How we can connect with patients with this type of intimate issues, we can understand the root of the problem. They don't want, they feel shy to talk with you like all the situation. You know the case, you know, but how is they are social, how do you approach that part?
I think that that is a wonderful place to start. So if I have a client who is dealing with something that's really difficult to talk about, which happens, the fact that they were brave enough to come into therapy and ask for help in the first place is a huge step. And I would really make sure to acknowledge that bravery and take my time. I like to meet my clients where they are. If they're not quite ready to communicate about something specific, I will work around that. Therapy is, you're meeting with a complete stranger in the beginning who you don't know. So of course there's going to be a level of hesitancy and shyness. And I think that patience is key. It takes time, it takes vulnerability, which takes a lot of strength.
What is the pre and post care for a patient who wants a laser treatment to stimulate the hydration and skin rejuvenation?
In preparation for treatment, I think beforehand it's mainly to assess and to be sure that the person is a good candidate for the treatment. So before the treatment time, we discuss what the treatment is going to entail. Laser treatment is usually painless, but there will be some discomfort because the laser devices, the hand pieces that are used for vaginal rejuvenation would have to be introduced into the vaginal region, and so that may feel uncomfortable for a patient, especially if tightness and dryness is an issue. So counseling is very important just to prepare them ahead of time. And then during the treatment, reassurance is encouraged. So just reassure the patient as the treatment is going on, keep communicating. With laser treatments, it will heat up the mucosa over a period of time for some people. So depending on the laser being used. And so during that process, it's just important to keep up the communication so that the client can let you know when or if it's too uncomfortable, to avoid burning the outer area, what could be harmful. But for maybe a period of 24 to 48 hours, depending on the severity of the treatment that was done or how invasive the treatment was done, we avoid intercourse. But afterwards, they can continue their lives as normal. There is no significant downtime. That's the benefit of laser treatment. So they may just feel some warmth and they'll be counseled to expect that. But if they notice anything unusual, they should reach out. But with laser treatments, it's mainly a quite simple procedure. So there's not much harm that would come from that kind of treatment. We just need to keep reassuring them as the treatment goes on that they'll be fine.
Bueno, generalmente se recomiendan 3 sesiones, las cuales son una mensual, si estamos hablando de algún tipo de láser. También hay otros tratamientos como aparatología, como que han salido actualmente, como HIFU, radiofrecuencia. Bueno, todo depende de la expertise de cada profesional. Y se recomienda uno mensual por 3 meses y después anualmente ir a las mantenciones. Eso es lo que hacemos nosotros acá con el láser híbrido y fraccionado. Es importante, ya te digo, más que esto, hablar claramente con la paciente porque también se asocian otros tratamientos, ¿no? Como son la participación del equipo multidisciplinario para que esta paciente se sienta realmente apoyada y tenga claridad de cómo sobrellevar este tipo de tratamiento.
Thank you. Enlightening, encouraging, insightful. I was not sure what exactly to expect because when you reached out, I was quite surprised. And I've had a good experience, and it's reinforcing for me the importance of having specialists across different fields working together.
Probably inspirational, definitely insightful. I know that was already, and also motivating to meet so many other professionals in different areas. But I really rarely get to do this, like of different areas that I know nothing about. So that is really exciting for me.
Muy contenta de que me hayas llamado y poder estar aquí hoy participando con todos los profesionales. La experiencia siempre ha sido buena, tú sabes que esto nos nutre cada día más. Participar con todos ustedes para mí es realmente muy satisfactorio.